Okay, so here we have a patient who's got kind of a thick neck that she's frustrated with, and she wants us to give her a more elegant, snatched jawline. So the first thing that we oftentimes reach for, so in this case, this orange garment is her skin, okay? And the first layer under the skin is a layer of fat. We call it subcutaneous fat. And many times we treat that with a liposuction cannula. And so the liposuction cannula goes under the skin through a small incision, and we suction out the fat from several different areas. I might start in the middle here, but I oftentimes also come from the side, and I do everything I can to crisscross and make sure I'm suctioning from different directions so that all of this subcutaneous fat can be removed. So once we take that out, now we look at our patient again and we say, wait a minute, she's still got a lot of bulk there. How come? What exactly is going on? Why does she still have all this fullness? I mean, if I look underneath the skin and there's no fat left, I'm just looking down at platysma muscle. Why doesn't she have a smooth jawline? Well, sometimes we have to go underneath the platysma muscle. So we take a retractor, and then we make an incision in the platysma muscle and we divide it down the center to see what's underneath. Why do we still have all this bulk? Well, sometimes what we find underneath there is some deep fat that needs to come out. And so we can dissect this away from the surrounding structures. We remove the deep fat, which many times comes in layers. And once that's out of the way, now we take another look and we see, well, gee, she's still got some bulk here. And I notice she's got some loose platysma muscle, but we'll get to that in a second. So if I look underneath, can you change the angle? If I look underneath, sometimes there's a little bit of bulky muscle underneath there. So sometimes we'll go in and we'll actually remove some of the bulky muscle as well. In men, that's particularly useful because I really want that clean jawline. And that muscle is called digastric, and it is present on both sides. So I take both sides of that muscle out. I always leave a little bit behind. But now, as you see, we're getting a cleaner jawline and things are smoothing out. Only issue is, even if I take the retractor out for a minute, there's still this other bulk over here. And so when we look, we find that sometimes there's still one more structure down there. And that is called the submandibular gland. And in today's neck lifts, deep neck lifts, taking the gland out can make a tremendous difference. So you have a little bit of saliva gland on one side, and if we switch to the other side, there's a little bit on the other side too, which sometimes comes out in pieces. You got to be careful. A lot of folks don't like to take this gland out. Sometimes when I was in training, we used to talk about the possibility of patients getting dry mouth, but it never really happened, so we stopped worrying about that. And now if we take the retractor away, we can look and see, wow, she's really got a much nicer contour. Many times we actually will remove some of this platysma muscle and just kind of cut through here and tailor it so that when we sew it over, that's called a corset platysmoplasty. We sew it over in different rows. We put a central row and then a side row here and a side row on the other side to make sure that we're really contouring and adhering to the structures of the neck so that when we're done, the patient really has a beautiful, elegant jawline. And then the last thing is to redrape the skin. Now, sometimes with a neck lift, you really got to remove skin and you don't want to make an incision here. So we go behind the ear and we sort of pull it back like so. But when we're done, then the patient has a really nice, elegant jawline, the one that she actually came in and was requesting in the first place.
Okay, perfect.
Do you want my hands there or not?
Can you move them?
Mm-hmm.
Sorry, guys. Mm-hmm. Okay. That was good.
You think?
Yeah.